Well, I apologize that I'm not there with you in person. We are in the middle of a series of votes attempting to reopen the federal government unsuccessfully. Pretty hard when there's no actual negotiation happening. Very difficult when the House of Representatives is not even here in session. But I really appreciate you bringing together some super smart people to talk about how right now private equity is decimating our nation's hospitals, other healthcare institutions in our communities, how it's lowering the standard of care for millions of Americans across the country. Congratulations to Amy and Vanny and everybody at Brookings for the release of this new report. And again, grateful for the invitation. In August, I released my own report to tell the story of how one private equity company in Los Angeles called Prospect Medical Holdings had destroyed healthcare for thousands of low-income patients at 3 hospitals in Connecticut. I talked to a lot of healthcare workers and patients at those 3 hospitals. It's Waterbury Hospital, Rockville Hospital, and Manchester Memorial. And they told me and my staff about how Prospect, came in, typical of a private equity firm, made big promises about the major investments they were going to make in these hospitals, but instead the exact opposite happened. Prospect essentially stripped these hospitals bare so that they could flip them very quickly based on a highly leveraged financial transaction. They skimped on supplies, they cut the workforce, they prioritized short-term profits over patient outcomes. Surgical techs talked to us about how patients were left on the operating table without the required materials to sew them up. There were rusty stretchers, there were loose IV cords. I mean, it was just a disaster. One woman at Manchester Hospital died giving birth because an emergency C-section was done too late. All of this horror so that Prospect's CEO and his investors could become filthy rich. Now, the staff at those hospitals did everything that they could to keep the care as good as they could. They were heroic. They still are performing miracles, but ultimately they couldn't perform miracles with nothing. I'm proud to report, though, that in part because of our advocacy, these 3 hospitals are now in the process of being turned over to nonprofit entities instead of cycling through another private equity firm. So to me, this is simple. We act as if we have to just accept that the motivating factor in our healthcare system should be rapacious greed instead of taking care of people. But why should we accept this? Why do we accept that our hospitals and our nursing homes are just vehicles for the enrichment of the 0.01% crowd? Why should our grandparents be pawns in a game designed to let private equity executives compete with each other in a game of who has the biggest private jet? Like, that's dystopian. That's disgusting. And it's just our choice as a society and as a government as to whether we should allow it. And it's important to remember that it wasn't always like this. I think a lot about the insurance industry. Today we accept that the insurance industry is just big business. But, frankly, the motivation is not to care for people. It's frankly to deny people care, to drive people crazy trying to get reimbursement for care. Again, all in order to let investors and owners of these insurance companies live lives of luxury. Multiple vacation homes, yachts, fancy cars. Well, people are desperate for care. But where did the insurance industry start? It started during the Great Depression, when people were having a really hard time paying their bills when they got sick. And so the administrator of a hospital in Texas, Baylor University Hospital, comes up with an idea. He just says, why don't we start with teachers, who he noticed, because he was a former teacher, he noticed that teachers were having a particularly hard time paying their hospital bills. And this was also a problem for Baylor because they had a lot of unpaid bills that they were trying to collect on. So times were hard for the hospital, times were hard for these teachers. And so he creates a plan for about 1,250 school teachers in Dallas to pay 50 cents a month. And that would get them basically 21 free days of hospital care. It was just a way to help people afford care. And yeah, sure, the hospital was helped by reducing the amount of unpaid bills, but this was just about helping people. These Texas plans, they became the precursors to the Blue Cross plans. Ultimately, this was the nation's biggest not-for-profit healthcare insurer back when we thought health insurance was a public good. And that's what insurance was for decades. It wasn't a way to make profit. It was just a way to help people afford expensive care. Again, a public good, not a private source for excessive profit as it is today. Um, we were looking back at the initial criteria that the American Hospital Association used to approve health insurance plans. And it's just wild that this was a world that we lived in for so long. The criteria was that the plan had to be not for profit. The plan had to be designed to improve the public welfare. It had to cover hospital charges, and it had to allow free choice of physicians. Again, that's just a world that doesn't exist today, but it wasn't so long ago when hospitals wouldn't deal with an insurer unless the plan was designed to improve public welfare. So what happened? What did we as a country decide so that healthcare was no longer a public good? The cancer medications, for instance, would be treated like a designer handbag. Some people can afford, and then other people just had to go without. Well, it was a series of decisions, and I won't go through the litany of them, but it's the passage of the HMO Act in 1973 that provided these unprecedented incentives for for-profit insurance businesses. It was Reagan's deregulation of the insurance marketplace. Healthcare became a really profitable business, and the not-for-profit healthcare industry just couldn't compete. And the predominant model became for-profit. I mean, I tell this story because we've become so desensitized to corporate greed in our healthcare system that we forget it was ever different. Young people today have only lived in this system. They know it's fundamentally broken. They can feel it when they go to a hospital that's suddenly short on supplies, like these 3 hospitals in Connecticut, or when they go to an urgent care facility and they have to wait for 3 hours, or when they're booking an appointment online with the first available doctor instead of a primary care physician that they have a relationship that they know and trust. There's a soullessness, there's an emptiness to our current healthcare system now that the driving force isn't taking care of people. It's making a tiny number of people a disgusting amount of money. In my report, I talked really specifically about the lifestyle of the CEO of Prospect Healthcare. The craziest thing that I learned is that he has 2 mansions 11 minutes apart, somewhere outside of LA. He's got 2 different mansions, 10 minutes apart. And he's buying his second mansion at the same time that Connecticut hospitals are running out of supplies and the ceilings are crumbling. In the Brookings report, you talk about how Ralph De La Torre was attending equestrian events in France. Well, community members were out there begging for these hospitals to just be made safe. Private equity CEOs are worth literally billions of dollars, money made making healthcare worse for high-need communities like Waterbury and Rockville and Manchester. That is fundamentally immoral, and we don't have to accept it. The good news, and I know you'll talk about this, is that it's not too late. 58% of hospitals in the United States are still not-for-profit. So we could make a decision to stop the hospital industry from becoming purely a for-profit enterprise, the way that health insurance did, right? It may be too late for health insurance. It's not too late for acute care hospitals. In Connecticut, as I mentioned, we are in the process of converting those 3 hospitals that Prospect ruined into nonprofit community-centered institutions again. We've learned our lessons. We know that private equity doesn't just make healthcare more expensive. It doesn't just pad the pockets of wealthy investors. It actually makes care worse. The research here is pretty clear. It found, for instance, that patients at private equity-owned hospitals are more likely to get an infection. They're more likely to experience a fall. They're more likely to have a variety of adverse events following a procedure. There's another study of private equity-owned nursing homes, and this one is just damning. It shows that if you're a patient at a private equity-owned nursing home, you will have an 11% higher mortality rate than those that are not owned by private equity. So those are the stakes here couldn't be higher. This is literally a matter of life and death, in addition to being a question of whether or not we want to build a moral healthcare system, not a virtue barren healthcare system. So that's why I'm working on federal legislation right now to address this problem. And my legislation would keep private equity out of ownership stakes in our hospitals and nursing homes, so that in the future, what happened with Steward in Massachusetts and Prospect in Connecticut doesn't happen all over the country. And so to do that, we've got to have events like this. We've got to be willing to tell the stories of what happens to community hospitals and nursing homes and other healthcare centers that are bought by private equity, and all the immoral outcomes that result. And political leaders on both sides of the aisle need to have the courage to stand up against these deals when they're proposed for their communities. I don't, this issue, I think, is representative of a broader political realignment that's happening all over the country. People on the right and the left are freaked out at the massive consolidation of control over our economy that's happening writ large, but they're particularly worried about that in our healthcare system. And so this is a place where you could see Republicans and Democrats stepping up and saying, oh, enough is enough. We are not going to let happen to our hospitals what happened to our insurance industry. We believe, based upon the data, that there's just no claim that private equity ownership in our hospitals, in our nursing homes, lead to better care. We know it doesn't lead to lower cost care either. So I really appreciate the work that you're doing at Brookings to dive into this issue. I'm looking forward to the conversations with experts that are going to happen today, all in the name of improving American healthcare and preventing hospitals and other healthcare institutions all over the country suffer from the fate that those hospitals in Massachusetts and our hospitals in Connecticut have suffered. So again, sorry that I'm not there with you in person, but looking forward to getting a full readout of this event. Thanks a lot for having me.